Hello, can we start the meeting?
ఎస్ మ్యామ్.
హలో
శివ ఒకసారి లైవ్ లోకి వెళ్తుందేమో చూడు.
ఆ
ఇప్పుడు
చూసాను
అన్ని సెట్టింగ్స్ చేశాను. వచ్చిందా?
లైవ్ వెళ్తోంది బట్ ఒకసారి చెక్ చేసుకో వాయిస్ అంతా
ఫైనల్లీ వచ్చేసింది. ఇవన్నీ కాపీ పేస్ట్లు లింకులు అన్ని లేక చచ్చిపోయాను.
ఓకే
ఇప్పుడు మ్యామ్, జస్ట్ మినిట్ ఐల్ మేక్ యూ ద కోహోస్ట్ మ్యామ్. శివ ఒకసారి లైవ్ చూస్తుండు. మ్యామ్, ఐ హావ్ మేక్ యూ ద కోహోస్ట్. యూ కెన్ షేర్ ద స్క్రీన్ మ్యామ్. మ్యామ్ స్క్రీన్ షేర్, కెన్ యూ ప్లీజ్? ఓకే ఓకే. శివ కనిపిస్తుందా?
నేను చూస్తున్నాను. ఒక్క నిమిషం లైవ్ ఆల్రెడీ పక్కన పెట్టాను. వెయిట్ సెకండ్.
ఓకే,
ఇప్పుడు ఆల్రెడీ లైవ్ వెళ్తుంది కదా జూమ్ యూట్యూబ్ లో
వెళ్తుంది కదా.
వస్తుంది
అమ్మాయ్యా.
వస్తుంది ఆరికల్ అని చూస్తుంది.
అదే అదే ఇప్పుడు మ్యామ్ స్టార్ట్ చేయగానే ఇక్కడ నేను రికార్డింగ్ స్టార్ట్ చేయగానే అక్కడ లైవ్ అనేది కూడా స్టార్ట్ అయిపోతుంది.
లేదు ఆల్రెడీ లైవ్ వస్తుంది, మన మాటలన్నీ వినిపిస్తున్నాయి అందరికి.
ఆహా,
సో వీ కెన్
ఇది
స్టార్ట్.
కాదు కాదు, ఇక్కడ స్లైడ్స్ అన్ని కనిపిస్తున్నాయి. ఒకసారి ఫుల్ స్క్రీన్ చేయమని చెప్పవా మ్యామ్ ని?
చేశారు కదా ఆల్రెడీ. మ్యామ్ కెన్ యూ మేక్ ఇట్?
మ్యామ్ కెన్ యూ ప్లీజ్ అన్మ్యూట్?
మ్యామ్ కెన్ యూ ప్లీజ్ మేక్ ఇట్ ఇట్ హాస్ ఎ ఫుల్ స్క్రీన్ మ్యామ్.
Okay, yesterday only this much I could do.
I think we can edit that part, ma'am. Like we can see that slides on left side, right? So we can make it concise,
This,
right?
like, see, I'll tell you, okay? Like, if I click on the screen, it has to show full screen, no?
Yeah, ma'am.
See, I'm trying, but then it is the same.
Tap on the three lines. On left side, you can see the three lines, right?
Yeah.
Right.
See, there are only these rotate and insert, scan pages options.
Ma'am, are you using iPad, ma'am?
Yeah.
I mean, ma'am, can you please try to open this page in iBooks, ma'am?
I've installed, or is it an inbuilt app?
It's already pre-app in iPads, ma'am. You can just share that one. You can find it in iBooks.
Give me 1 second.
Just go to the share option. We can see it as open in iBooks.
This only open in a new window. See, there's no open in iBooks.
Ma'am, have you installed that app, ma'am? It's a
No, like I can install now.
yeah, ma'am. Kindly install that one, ma'am, so that we can get that full image.
Okay. iBooks, no?
Yeah, ma'am. The Apple Books, ma'am.
Okay. So that is, I think. After I
There's
give
an
share,
option, ma'am. Books option is there, right, ma'am? Tap it on. Now open it. So we got.
Once I check, I can write, okay?
Yeah, ma'am. Now we got it as full screen. You can slide it, ma'am. When you are going to edit that one, we have an option over there, edit option. There we can tap and we can edit, ma'am. Yeah.
Okay. 1 second. Okay.
Live తీసుకుందామా ఇంకా?
Yes, we can start.
Ma'am, can you go for
Ma'am,
live? Is everything okay?
Yes.
Okay then.
Yeah.
So start చేయండి. నేను మ్యూట్
Yes.
చేసేస్తాను.
Hi, everybody. Welcome to this class of toxicology where we'll be discussing about organic poisons. I'm your forensic medicine educator, Dr.prashi, and I'll be guiding you through certain questions in the topic organic poisoning. Now, coming to what are the questions that we'll be discussing today. Coming to the long answer, we'll be discussing about how do we classify venomous and non-venomous snake. So this is a very important question. We'll be discussing about both venomous and non-venomous snake and also about what is opistotoxemia, signs and symptoms and treatment in the case of snake bite. Coming to short, we have this question of scorpion sting. So here also we'll be discussing about the signs and symptoms and even treatment of scorpion sting. Now, coming to shorts, we have three questions. Number one would be tox argument, then we have ergotism, and then we have sues, which are used as cattle poison. Now, coming to the app per se, what is Auricle? So, Auricle is a platform which is going to give you wide range of study tools, including recorded classes, live classes, practical sessions, exam module, and hard copy book sets. Now, coming to how can you use this recorded classes? So, these recorded classes would offer you a flexible learning tool. That is, you can use these to study anywhere at the comfort of your home or hostel or wherever you're staying. Now, coming to the educators here, all these are expert instructors who are going to tell you how you need to approach the subject, and also they're going to give you in-depth knowledge about the same. Also, you are going to easily revise all the concepts because it is going to give you a convenient revision tool. All the modules are covered in very short time, ensuring that all the important 10-year PYQs are covered so that just before exam you're taken care of. Now coming to what is there in live classes. So these live classes are the classes with questions which are very important. And these are the questions that are very much anticipated in your coming exams. So what happens, a lot of students know about the concept, but they do not get enough marks in the exam because they do not know how exactly to write a paper. So that is where live classes will come to your help. It is going to give you in-depth coverage of the previous 10-year question paper, and it is also going to give you all the most anticipated questions. All the educators are very experienced. They're going to give you a thorough knowledge of all the concepts. Answer writing skills are going to be taught. They're going to give you study plans and so many more. Innumerable other benefits. Coming to the next important feature here, it is going to be an interactive learning session. So these are all live, right? So if you have any doubts, you can anytime ask the educator and you do not have to worry about anybody judging you for asking your doubts. Now coming to the express exam module, here the entire syllabus is covered in less than 20 minutes. And you can revise all this in very small amount of time. And just before exam, when you do not have a lot of time to revise, this is going to help you a lot. Now coming to the other things that exam module produce, see, when exam module is given, it is going to guide you through how you need to write an answer. Because even though you know a lot of concepts, if you do not write it properly in the paper, no use, right? You're not going to get that mark. That is where exam module is going to help you. And the educators are going to guide you through every step here. Coming to the one-to-one doubt clearing session, these are for those students who need that extra, approach from the educators. There is going to be student-centric approach so that all your doubts are cleared. There's going to be personalized attention for all the students, and it is going to be a very, very, very safe learning experience where you do not have to have the fear of being judged. Now, coming to the hard copy notes, I know it is very tedious and very cumbersome task for everybody to make notes. And when coming to the entire syllabus per se, writing everything would be a very daunting task. That is where these notes come into help. They give you in-depth coverage of the entire topic. They're going to be diagrams, flowcharts, and flashcards, and so many more, so that your learning becomes easier. So what you can do is, when you listen to your educator teaching, you can you can highlight all the important things in your notes so that it becomes easy for you to revise. And also there is space given where you can fill in extra details so that you do not miss out on anything. Now coming to the next feature, it is nothing but question bank. There are questions covering three levels. That is from basic, beginner level, it goes up to the expert level, which is the last level. So what happens? You have to start with the beginner level. Once you finish all this, you are thorough with the foundation. After that, you can switch to the next level, and finally, when you go to expert level, that is when you have mastered the subject. Now, coming to practical sessions, These practical sessions are going to give you hands-on experience and all practical exam. It is also going to guide you through the Viva. And usually, what happens between the time when practicals happen in your college and the actual time when you're giving practicals, there is a time gap. So, in order to bridge that, practical class sessions are being taken in Auricle so that you do not have to miss out on anything. Now, coming to the different plans that are available, there is foundation plan, there is advanced learning plan, also the complete learning plan and ultimate MBBS plan. So foundation plan comes with pre-recorded classes, live classes, expert exam module, practical session, and Q bank. This is the basic plan, that is the foundation plan. After which there is advanced, complete, and ultimate plan. When you come to the complete learning plan, you have extra things like hard copy note set and also one-to-one doubt clearing session. And when you come to the ultimate MBBS plan, it is for 4 years. So you're covered through and through throughout your MBBS journey. Now, coming to the topic first thing, today we'll be discussing about organic irritant poisons. So organic irritant poisons, so let it be any animal bite, insect bite, everything comes under organic irritant poison. Now, why is it important to learn this? Because you might get an insect bite anytime, or a person can come with you with an insect bite, snake bite, or the child might be playing with some colorful flowers and later might become unconscious because of some plant poison compound that might be there. So these are very commonly seen scenarios. That's why you need to be very thorough about organic irritant poisons. Now, coming to the first question, that is in long answer, we need to classify venomous and non-venomous snakes. So this part can come separately as a 5 marker as well as 3 marker. Then you need to write about what is opisthotoxemia, signs and symptoms, and treatment in a case of snake bite. Now, initially, let's classify what are the snakes. So, while coming to snakes, in poisonous snakes, there are going to be 3 types. One is the family Elapidae, next there is Viperidae and Hydropidae. Now, coming to Elapidae, these are the snakes which are neurotoxic, that is CNS manifestation, supervene. They are nothing but cobra and crate. There's also one more snake called as coral snake, but that is not important in terms of the exam. Now, coming to the next group, it is Viperidae. These are all hematotoxic. That means bleeding manifestations are going to be the main symptom whenever there is a bite from these snakes. The snakes under these are the normal viper snake and the saw-scaled viper. Now, coming to the next group, it is Hydropidae. So, Hydropidae, as a name suggests, hydro means water. No? So, these are the snakes that are living in water. Mostly all these snakes. And these snakes, whenever they bite, the person presents with features of myotoxicity or cytotoxicity. Myotoxicity, in the sense, when you look at the bite area, there's going to be necrosis and there's going to be fluid oozing. So these are the features that are seen in myotoxicity. Now, coming to the second part of the question, difference between poisonous and non. As I told you, this question can come separately as a 5 marker as well as 3 marker. So coming to the difference between these, now coming initially we'll have to write a point about belly scales. Now in poisonous snakes, the belly scales are very large and they cover the entire breadth of the belly. So for example, if this is the snake, the scales are going to be like this. They're going to be very big. Whereas in non-poisonous, they are very small. That is, they are just so much. They're very, very, very small scales. Now coming to the head scales, in poisonous snakes, they are small. So it is exactly opposite. That is, the belly scales and head scales are opposite. Remember one thing so that you do not get confused in your exam. So remember, wherever there is a question where there are two contradicting statements, always try to remember one statement because the other is going to be exactly the opposite. If you remember both, you tend to get confused, and then in your exam, you'll be sitting there thinking whether belly scale was small or whether head scale was small for a poisonous snake. And coming to non-poisonous, they are usually large. Okay. Now coming to what are the seen in fang marks. So what are fangs? They are hollow like hypodermal needle. Whereas in non-poisonous snakes, fangs are short and solid. So what are these fangs? Now, if you take the head part of a snake, these areas where they actually bite, no, this is called as fangs. So in a poisonous snake, they're going to be hollow and they look like a hypodermic needle. Whereas In a non-poisonous snake, it is going to be short and solid. That is, if this is the head of the snake, it is going to be very short and it is going to be solid like this. Understood? Okay. Now coming to the next point, you're going to write about the features in tail. In poisonous snake, the tail is going to be very compressed. That is, it is going to be very narrow like this. Whereas in non-poisonous, it is going to be almost normal, not that compressed, somewhat like this. Coming to the habits, all the poisonous snakes are nocturnal, that is, they usually bite at night. Whereas coming to the non-poisonous snakes, they are not so, that is, they can bite at any time of the day. Now, coming to the teeth bite marks, in poisonous snakes, you usually see two fang marks with or without marks of other teeth. This is the important thing. And coming to non-poisonous snakes, there are also two fang marks are seen, but then you're going to see lots of teeth. Like along with the fang marks like this, all the other teeth marks are also going to be seen. So it is going to be an entire structure. Now coming to the snake venom, that is nothing but the saliva of the snake. Remember that the cobra venom is going to be transparent and yellow in color, whereas for Russell viper, it is going to be white or yellow in color. And what happens? These venoms, they travel through the lymphatics and reach the superficial veins. That is, once after the snake bites, how does the venom spread? So there is going to be lymphatic spread mostly. In the question, they're not asked about this part, but always make sure that you mention one or two mark fetchers. In this question, this could be a mark fetcher for you. Now coming to what is opisthotoxemia. Opisthotoxemia is nothing but poisoning by snake venom. Now, once the snake bites, what are the most common symptoms that are seen? Most of the symptoms that happens in the patient is because of the fright or fear that happens. Anybody know when it comes to a snake bite, anybody would be scared. And whenever a person is scared, the sympathetic system gets activated, and that is what leads to most of the symptoms. And that is why here also we mention about fear or fright as the first symptom. And sometimes there could be a psychological shock and death. And the reason for this also is same. It is not per se because of the poison, it is because of the fright. Now coming to the cobra bite. Cobra, as we discussed, it came under Elapidae, and this is the first group of snake that we are discussing. Now coming to Elapidae bite, this cobra or prey bite, they're going to be neurotoxic, that is CNS symptoms supervene. They mainly act on the neuromuscular junction, therefore it is going to cause weakness. These are very dangerous because whenever they affect the diaphragm, there is going to be respiratory fear. These symptoms do not start immediately after a snake bite. They usually start 15 to 45 minutes after a snake bite. Now coming to what are the local symptoms that are there. As I told you, these are poisonous snakes. So whenever there is a bite of a poisonous snake, the fangs are going just to a number. That is, there are going to be two puncture holes. There's going to be pain, redness, hotness, swelling, even be wet gangrene, but these are less prominent because most symptoms that arise because of a Elapidae bite are related to CNS. While coming to hematotoxic snakes like Russell viper, their hematotoxic, the toxin is going to mainly act on the blood vessels, all the RBCs. So there, those symptoms are more prominent. Now coming to what are the systemic effects. First sign is ptosis. Not only here, when you talk about neuromuscular disease, even then the first is ptosis and numbness in the lips and tongue. Apart from that, there is going to be giddiness, heaviness in the bitten limb, salivation, vomiting, blurred vision. There's also going to be dysarthria, dysphagia, bradypnea, convulsions, coma, and death due to respiratory failure. That is the ultimate thing. So whenever you are writing about systemic feature, use always start now because this is a serious toxin. You know that it is going to affect serious, right? So write about the serious things like ptosis, giddiness, all these come under serious. Later you write about other things that could happen in the face. So you give this head to toe approach so that you do not miss on anything. So in the face, you can write about salivation, vomiting, blood vision that is in the eyes. After that, you write about the GIT. So there is dysarthria, dysphagia. After GIT, you jump to RS. That is how you remember all the systemic symptoms. Now coming to the second group of snakes, these are viper. And as I told you, the viper bite is going to be a hematotoxic bite. Therefore, mostly what happens, all the features of necrosis and too much bleeding, these are going to be the major symptoms. Now, coming to the major components in the venom of a viper bite, there are going to be things like hemolysin, thromboplastin, and cardiotoxin. So, these are going to be toxic to the entire CVS system in the patient. And these venom can also cause hemolysis, destruction of the vascular endothelium, cerebral and intestinal hemorrhage, hypotension, shock, and even tissue necrosis. So here the person at the end, he might die out of hypovolemic shock because there is too much blood loss. Now coming specifically to the other symptoms that are seen in the of viper, coming to the local symptoms, they are going to be very, very prominent. They're going to show fang marks. As I told you, it's a poisonous snake, so fang marks are going to be 2 in number. Apart from this, there's going to be severe pain, redness, and ecchymosis around the area of bite. There is going to be hotness, edema, swelling of the affected limb, and there can also be dry ganglion that is seen. Coming to the systemic features, there could be nausea, there could be vomiting, hypotension with rapid weak pulse, bleeding from mucous membrane. Why is there a rapid weak pulse? It is because of the hypovolemia that is seen in these patients. There can also be acute renal failure. Acute renal failure is because of, see, whenever the RBC is lysed, all the end products ultimately go, they settle in the tubules of the kidney, and finally they cause acute renal failure. This happens in the bite with sea snakes also. There are very few sea snakes which are poisonous. Even when they bite, all the components of the muscle metabolism at the end go and get lodged in the tubules of the kidney and ultimately lead to acute tubular necrosis and hence death of the person if not treated in time. Ultimate things could be coma and death due to circulatory collapse because as I told you, it is a hemotoxic. There's going to be a lot of blood loss and finally circulatory collapse. Now coming to the last group of snake, that is nothing but the squeeze snake. Symptoms are not produced in 80% bites, marked myositis seen. That is, these snakes are nothing but myotoxic. And whenever there is something that is acting on muscles, myoglobin is released, and this myoglobin will go and deposit in the kidney tubules, and it will lead myoglobin urea. That is, myoglobin is excreted in the urine of the person. Now, coming to what is the management of the toxicity in case of snake bite. Firstly, you have to reassure the patient. Most of the snakes, even though they bite, they do not envenomate. That is, they do not insert poison into the body. That's why you have to always reassure the patient first. After that, you have to properly examine the site of bite and decide if the snake was poisonous or it is not poisonous. How do you do that? By looking mostly at the bite. So if it is a poisonous snake, 2 fang marks. If it is not a poisonous snake, 2 fang marks. Along with it, the entire teeth of the snake is seen. So you have to first look into this thoroughly. And then you have to do this because simply you do not have to use the anti-venom, right? Because in some people, anti-venom can bring in certain reactions. So to avoid that, you do not give anti-venom to every person. Only if it's a poisonous snake, you usually give the anti-venom. You have to immobilize the affected limb. That is, you ask the patient not to move or else you give a support in such a way that the person doesn't move his hand or limb wherever the snake has bitten so that the travel of poison is limited. And then next step would be you have to stop the absorption as much as possible by tying a tourniquet. For example, just imagine there is a hand bite in this area. So you have to tie a tourniquet somewhere here. And you have to loosen it here and then, like once in 10 to 15 minutes, in order to prevent necrosis of that area. And always make sure that your tourniquet is not very tight. If it's very tight, it is going to lead to necrosis because of stoppage of the blood flow. Now, coming to what supportive treatment you can give in case of snake bite. Always start an IV line to correct any fluid, electrolyte, and acid-based disturbances. You know what happens? whenever there is snake bite, as I told you, because of fear and fright, the sympathetic system is going to get activated. And when sympathetic system is activated, the person comes with lot of sweating and he tends to lose lot of water from the body. That is why fluid correction becomes one of the important measure in the symptomatic or the supportive treatment in case of snake bite. In all cases of snake bite, either poisonous or non-poisonous, we have to always give broad spectrum antibiotic because there is a bite and that bite is foreign. So there is a lot of chances of it becoming contaminated and some other pathogen could grow there leading to infection. In order to prevent it, you have to always start the patient on any broad spectrum antibiotics, and also you can do hemodialysis because as I told you, the breakdown products of hemoglobin or myoglobin could sit in the kidney tubules and lead to renal failure. Hence, to prevent it, you have to do renal hemodialysis. Now, coming to what is this very specific treatment in case of a snake bite? It is nothing but giving antivenoms. So there are two types of antivenoms. It is either monovalent or polyvalent. Monovalent are effective against only one species. That is why it is called mono. Whereas poly, it can be given for bite of all the poisonous snakes. That is, it is effective for cobra bite or crate or your vipers. Now, what is the dose? It depends on the severity of the snake bite, and it does not depend on any other of the person or about the body size of the person. And for children as well as adults, you give the same dose. You usually give around 3 to 5 vials, and if the wound is very big, you can give around 5 to 10 vials. And if it is a severe case, you can give around 10 vials and maintain with more vials according to the situation. Okay. Now, coming to a test. This test is also not asked in your exam, but if you write about it, it is going to be an extra mark fixer. So, wherever I put a star mark, no, you make sure that you note it down somewhere or in your Auricle hard copy book, or if you are taking notes by yourself, just mention this point because these are all the mark fetches. Always remember in exam you need to put 2 or 3 points like this for each question to get that extra mark. So what is this 20-minute blood clotting test? Here you take some ml of fresh blood and you put it in a dry test tube and you let it sit somewhere. So there is a test tube stand and you keep that test tube undisturbed. You're going to keep it for 20 minutes. That's why in the name it says 20 minutes. After that, you are going to tilt the test tube to see whether the blood flows or not. If the blood flows off, that means it is a hematotoxic venom. So what makes venoms are hematotoxic? It is usually viper. Whereas if it clots, it indicates that it is something else, maybe a crate or a cobra. Okay, so that is the end of the first question. Now coming to the other short answer, we'll be discussing about what happens in case of a scorpion snake. We'll be talking about the signs and symptoms as now initially. Let's talk about what is a scorpion and what is a scorpion venom. Scorpions are poisonous arthropods that have a fleshy segment body with 4 pair of legs. Let's count 1, 2, 3, and 4. A pair of claws and a tail. So this is a pair of claws and a tail. So you do not have to remember all these details. So forensic medicine is a subject where an image speaks a lot of words. Okay, so if you know how a scorpion looks like, you can make this entire line about scorpion by yourself. Therefore, make it's a point to see related images when you study, so that it becomes easier for you to revise. Okay. Now the sting of the scorpion communicates with the venom gland by means of a duct, and it then injects venom in the injury produced by it. The adult scorpion is 2 to 20 centimeter long, a black colored, and more dangerous than the small brown ones. So remember, a black scorpion is always more dangerous. Coming to scorpion venom. The main toxins include phospholipase, acetylcholinesterase, hyaluronidase, serotonin, and so many other neurotoxins. So remember at least two. Remember phospholipase, acetylcholinesterase, and hyaluronidase. Scorpion venom is clear and it is usually colorless toxalbumin. Now, what is toxalbumin? We'll be discussing in a further question. Coming to the scorpion venom, it is neurotoxic. That is, it blocks the voltage gated sodium and potassium channel. Therefore, it prolongs the action potential and there is going to be excessive release of catecholamines. So whenever there is too much catecholamines released in the body, there is going to be adrenergic manifestations that are seen. This repetitive firing results in autonomic and neuromuscular overstimulation symptoms, and it prevents normal nerve impulse transmission. And whenever there is accumulation of acetylcholine, there is going to be cholinergic manifestation. This happens in the case of even OP poisoning. Coming to the signs and symptoms, coming to the local symptoms, there is going to be severe intense pain, and there is also going to be numbness and tenderness area where there is a sting. Coming to other systemic features, let's take each system and write about it. Firstly, let's take CVS into consideration. There is going to be sinus arrhythmia, hypertension, pulmonary edema, ischemic changes in the ECG, and all these complications are more seen in children. Now, coming to the next term, the important one is CNS. As I told you earlier, the scorpion venom is mostly there's going to be agitation, paresthesia, irritability. There is going to be very jockey and shaky movements of the extremities. That is his hands, for example. It is going to be like this. Okay, so because the venom is colorless, the doctor might find it hard to tell what caused the poisoning in some cases, because maybe if a scorpion has bit a person in sleep, and because the venom is colorless, you cannot see it. So there might be a tough time identifying a case of scorpion bite at times. There's also going to be cerebral edema, and finally, it can lead to convulsions and even coma. Now, coming to what are the other symptoms, these are going to be the same symptoms that are seen in any other organic matter poisoning, like nausea and vomiting, hypothermia, blurring of vision. There's going to be fasciculations seen in the tongue. So, see, tongue fasciculation is one more CNS manifestation, diaphoresis, that is excess sweating and tearing. So, most of these are the features that are seen in OP poisoning. That is, all these are the cholinergic features. So, while reading about scorpion poison, remember there are cholinergic features so that you can save little time while studying, and in the exam, write about those cholinergic features. Coming to how do you manage a case of scorpion sting, first aid. Whenever there is a snake bite, whatever you do, the same thing can be done here also. Because there's going to be too much pain, you can always use a local anesthetic so that the patient becomes calm and he doesn't scream out of pain. And coming to the specific treatment, you're going to use poly-antivenom. A poly-antivenom is specific for scorpion. Like how you have antivenom for snake bite, there is also antivenom for scorpion bite. Supportive treatments include all those treatments which are given so that complications are prevented. Don't attempt to cut the wound or out the poison. See, this is the same in the case of snake poisoning also. We have seen in a lot of old movies that if there is a case of snake poison, one more brave person jumps in and sucks in the wound. No, it shouldn't be done, because if that person, whoever is sucking the wound, if he has scary teeth, the poison can spread through his lymphatics and he may die instead of this person. Okay, so that this is one take home point from this question. And whenever that person sucks in, or whenever you try to manipulate the wound, there could be infection that could happen there in the future. Okay, now coming to the three shots. In short, the first question would be toxalbumin. So, what is a toxalbumin? So, toxalbumin are the protein toxins, and these are found in the organic matter. And most commonly, these are found in plants. And for example, it is seen in plants like ricin or castor beans or abrin. So these are all the organic plant poisons, right? So the protein poisons that are found in all these plants are in general called as toxalbumin. What is the mechanism of action of these toxalbumin? They inhibit the protein synthesis in the cells, leading to cell death. So no, there is going to be S phase in the cell cycle, that is a synthesis phase, and then there is going to be one more phase, the M phase, so on. These are the phases when the cell goes through all these, only then the cell cycle continues. There is the G0, the gap phase and everything. So when these toxalbumins are given, they bind to certain substances in these cells and prevent the protein synthesis from happening. The plant poisons are also called as phytotoxins. And there are certain animal toxalbumins also. They are nothing but snake and scorpion venom. So in general, remember, any poisoning from an organic substance, be it a plant or an animal, is called as a toxalbumin. Coming to some more points about toxalbumin. What happens when there is poisoning? There could be varied symptoms. Okay, so whenever you write about signs and symptoms for this in general, you think about any one big 10 marker that is there in this chapter, and from that you can write this answer. First, write about the symptoms seen in GIT. Then you write about what happens in RS. Wherever could be like vomiting, diarrhea, abdominal pain. All these could be seen. Along with it, each system-wise specific points can also be written. So coming to the dose and toxicity, toxalbumins are highly potent. Even small amount can be very, very fatal when ingested or injected, and therefore medical treatment is warranted. So what is the take-home point here? Now, coming to organic poison, apart from snake bite, there are also so many plants, right? Like the plants like datura. So datura are very colorful, but they are in so many people's garden, and these people may not even know that this plant is poisonous. But what they need to realize is that even little amount of this plant could be poisonous. So you a child playing there might just put his hands on the flower, or put the flower into its mouth, and it could lead to the death of the child if not taken care of properly. That is why thorough knowledge about all these plants and avoiding them in the garden could be a great lifesaver for so many people. Now, these are also used in research and medicine. Uh, Despite their toxicity, toxalbumins are studied for their potential use in targeted therapies for cancer and other diseases. That is where it comes into use. So coming to the next question, it is about ergotism. So in this picture, you can see this, right? There is growth of the fungus, Claviceps purpura, on these grains. So this is a picture of a grain. There could be growth of fungus, Claviceps purpura. It can grow in various type of grains like rye, barley, wheat, and even oats. What are the signs and symptoms of ergotism? There could be nausea, vomiting, and diarrhea. That is, there is going to be mainly the GIT features. Apart from that, there is going to be difficulty in breathing, chest tightness. That is, as I told you, remember systems. Always start with GIT, go to RS, go to CVS, go to CNS. So that gives you the whole answer. And there are certain questions where muscular features are also seen, so you can include even those. There's going to be numbness and tingling in the hands and feet. So this is a CNS symptom. And lastly, you can write about the hematological manifestation. There is going to be bleeding in the nose and mucous surface. In all these, the two most important things is like the chest tightness and the numbness and tingling in the hands and feet. That is, see, the other things are common for most of the organic poison. So when you read also, if you read about 110 marker, you can get a general fair insight as to what comes under signs and symptoms for most of these. But there are some specific things that you need to mark and keep. So when you don't have time, you have to focus on that and go to your exam. That thing here in this question is the chest tightness and the numbness and tingling that is seen in the hands and feet in case of ergotism. Next, we need to write about what is Saint Anthony's fire. It is a burning sensation in extremities, delirium, and convulsion. See, this is also one more important thing. Put double stars here. When you write this, examiner knows that you have in-depth knowledge about the subject. Why is it called as Saint Anthony's fire? Because there is burning sensation seen in the extremities. Now coming to ergotism per se, it is a tingling and numbing sensation in the skin. There is also going to be dry gangrene that is seen. And there could be other neurological features like hallucination, ataxia, convulsion. And he can also have certain features like some insects crawling under his skin. So ergotism per se is only this much. But if you write only this much in your marker, in your shorts, you're not going to get the entire mark. That's why you need to know what else is related to ergotism. Write all that and then you write ergotism along with it. Now, coming to treatment, you can give stomach wash and you can also give purgative so that the person loses all these and then the further absorption of ergot doesn't happen in the body. Now, coming to the last question, this is nothing but sues. So, sues are the substances which are used as cattle poison. Okay, so sues are the mainly the seeds of the plant called as Abris picatorius. So, Abris picatorius is also one of the most common organic poison, and more than its poisoning effect on humans, it is mostly used as a animal poison to kill cattle. So, it's a cattle poison. And these seeds are decorticated alone or it is mixed with datura, opium, and onion. Okay, so you can use this seeds solely or you can mix it with all these and then you can make it a paste along with combining it with water and spirit and you make needles out of it. So, what is the meaning of sui? Sui is nothing but needle. So, finally, after you make it into a paste, you're going to knead it into a fine needle. So, it is going to look like this. And the weight of this is going to be around 15. The weight is going to be around 10 milligram and the length is going to be around 15 millimeter. So 15 millimeter is just 1.5 centimeter, no? So it's going to be just this small. Therefore, diagnosing it could be difficult at some instances. Now coming to what happens in the case of poison. Poison in cattle often manifests as drooling. So these are the features that are seen in cattle, okay? Drooling, diarrhea, abdominal pain, lethargy, weakness, and in severe cases, respiratory and cardiac failure. So what do you understand from this? All the systemic manifestations are seen. In GIT, there is diarrhea, abdominal pain. In the muscular system, there's going to be lethargy and weakness. In the respiratory system, there is going to be respiratory failure. And in the heart, the pumping action fails. Therefore, there could also be cardiac failure. Now, coming to what systems are affected. As I told you here, digestive system is affected, nervous system is affected, and also all the other vital organs are also affected. Many toxins, like those of from certain plants, inhibit enzyme function and disrupt metabolic processes also. So a lot of these poisons they bind to certain groups, like for example, the sulfhydryl group of enzymes. And when if these enzymes are playing a key role in certain processes like those of respiratory chain, the respiration is going to be arrested, and therefore the cell cycle stops and the functioning of the cell stops. Therefore, there could be death of the cells. So coming to other points that you can write here, what is the management of a case of by a SUI? First, you can do preventive measures, including avoiding contact with cows to have a thorough check about the feed that he is going to feed all this cattle. He should also ensure clean water source and monitoring the pasture for all these toxic plants. In some cases, providing detoxifying agents or symptomatic treatment may also help. But remember, even though the person takes all these measures, it cannot help always because mostly these SUIs are used as cattle poison in the rural community by the farmers. So, for example, if a farmer has a grudge on another farmer, and imagine that another farmer has a lot of cows. Now, what this farmer is going to do? He is going to do something so that his aim would be to kill those farmers so that maybe his grudge is taken care of or he feels like he'd be more rich or he would have more cows, something. These are going to be the mentality of a typical case where a sui is used as a cattle poison. And as I told you, this sui, which looks like this, it is going to be 15 mm thick. That is just going to be 1.5 centimeter. The farmer is going to take a wooden board. Now, this is a wooden board. And he is going to pin the sui on the board. Okay. So not only one sui, he can use many. Like for example, so two suis are put. Now he is going to take that wooden board and slap the cow as fast as possible. So when he slaps, what happens? The wood is going to be there in his hand, but the sui leave the wood and go and sit on the skin of the animal, or it might travel the muzzle. And all these symptoms are seen. And because these are very small and thin, they go unnoticed. So the person may not get to know that his cow died because of poisoning by such a compound. He might just think that it is because of a terminal illness that his cattle has died. And whenever this is used as a poison to kill a human, they usually take the sui. And imagine this is sui. This is a pretty big thing to show a sui, but imagine this is a small thing. In between his fingers, they're going to keep the sui like this. And they generally go into slap the person. So when they slap, what happens? His hand is going to be here only, but this needle enters the skin. That is how the manifestations are seen. So what is the economic impact out of this? Poisoning can cause significant economic losses due to cattle death, decreased productivity, or the cost and treatment. Because they it takes a lot of time to identify what caused this poisoning and what happened because it is very difficult to identify. Therefore, it could be a big economic burden on the farmer. And if the livestock dies, it could also act as economic burden to the farmer. So that's all we had to discuss in today's class. These are the important questions from the chapter Organic Irritant Poisoning. This video was helpful for all of you. Happy learning and thanks for watching.